Hello there, this is Ethan on Staying Healthy Kimberley on Warringer Radio 693 AM. Today we have Annie, who is a health care and well-being program manager from OVAHS. Hello, Annie.
Hi, Ethan. Nice to speak with you.
Um, what is the purpose of National Stroke Week?
So, National Stroke Week is a community event where we aim to increase and raise the awareness of the impacts of stroke and for people to get health checks. Feel free to come to get their health checks so they can learn about the signs and the symptoms of stroke and how to manage those if they are impacted by stroke.
Yeah. And what is the provision of stroke?
So the prevalence of stroke. So chances are, Ethan, that either like that you or someone that you know have been impacted by stroke. So 1 in 4 people globally will experience a stroke, and in Australia there is one stroke every 19 minutes. So it's a very common health event, and it affects people from all ages, from all demographics, and all social groups in society.
Yeah. And so what is a stroke?
Okay, so that's a really good question. Thanks, Ethan. So there's actually two types of stroke. So the first type of stroke happens when there's a blood clot in the brain, and the oxygen supply to the brain is reduced. And or the second type of stroke is when a blood vessel in the brain bursts. So because the blood controls all that we do, such as the way that we move, the way that we think, and the way that we feel, it can have a significant impact on our life.
Yeah.
Every stroke is different because it depends on what part of the brain the stroke occurs in and how severe it is. So it's either a burst blood vessel in the brain or it's a blood clot in the brain.
Yeah. And so after a stroke, what do people experience?
Yeah, so after a stroke, people can experience weaknesses down one side of the body, difficulty swallowing food or drinking food. It can affect because it impacts on different parts of the brain, it can affect their personality and their behaviour. So their personality and behaviour might change from what they were like before they had their stroke. It can impact and change their speech and their understanding. So the messaging in the brain changes. So they might not receive clear messaging. They might not be able to understand the messaging that you're trying to send to them. And it also can cause vision loss. One of the real long-term impacts of stroke is fatigue. So people feel tired after they've had a stroke, and that really affects their ability to go back to activities that they used to do before the stroke, and it can also cause them to have some depression, and anxiety, and it impacts on other senses. So they might lose their sense of taste or their sense of smell.
Yeah. And so who can suffer from a stroke?
So the truth is that a stroke can happen to any of us and at any age. So even some babies, when they're still growing inside the mum's abdomen, inside the mum's belly, they can have a stroke. However, having said that, as we get older, our risk for stroke increases. But the other risk factors that we can't control are our age. So as I say, the older we get, the more likely we are to suffer from a stroke. Our gender, so men are more likely to have a stroke than women, and our family history. So if there's been someone else in our family that's had a stroke, that's what they call a predisposition. So you are more at risk of having a stroke. So the factors that we can't control is that the factors that we can control, excuse me, is the quality of sleep that we get. So it's really important that if people have a condition called sleep apnea, which means that when they're trying to sleep at night, they stop breathing for a very short space of time. That can cause stroke. Smoking contributes to stroke because we know that smoking narrows the blood vessels and the arteries in the vein, which can cause that blockage or that blood clotting. Being overweight is a factor, and high blood pressure is really significant. So is high cholesterol. So if we've got too much fat in our blood, that contributes to stroke. And another condition called atrial fibrillation, which is an irregular heartbeat, that can lead to stroke, and diabetes and stress. There are also factors that can cause people to have a stroke.
Yeah. Can stroke be prevented?
Absolutely, Ethan. So as I said to you, that there are factors that we can control. They were the ones that we just spoke about. So most of the strokes can be prevented, and the best place to start to reduce your stroke risk is to have regular health checks with the nurses and your doctors at the local clinic. They'll check your blood pressure, they can do your bloods to check to see if you've got good cholesterol, and they will also check to see that your heart rate is okay, that you've got a regular heart rhythm, and managing blood pressure, modifying diet, and making some lifestyle changes. Then there's some really important things that people can do to reduce their risk of stroke. So as we say that medication can help manage high blood pressure and high cholesterol, but even just adopting healthy lifestyles like cutting out the sugary drinks, stopping smoking, walking regularly, those things will help prevent stroke.
Okay. Is there any information or phone number that people can contact OVAHS in
Absolutely.
issues?
So yes, absolutely. So anybody who wants to come, we're on Wednesday of next week. So Wednesday, the 4th of August, we're having a health promotion activity at OVAHS. So between 11:30 and 1 p.m, we're inviting our community to come down and have some healthy tucker with us, and we'll have some nurses there that'll be checking people's blood pressure. We're going to have a guest speaker, Mrs. Patricia Ward, who is a stroke survivor, so she's going to come down and tell her story to people. So please feel free to come next Wednesday between 11:30 and 1 p.m. and come and join us at OVAHS for a healthy barbecue and a health check. But otherwise, always you feel free to get in contact with OVAHS on 9166 2200, or otherwise just come to the clinic and ask for one of the nurses to do a health check with you and check your blood pressure. So our community members are always welcome to come down and get a health check.
Okay. Thanks for coming on the show, Anna.
You're very, very welcome. Thanks for having me, Ethan.
That was Anna, who is a health and well-being program manager from OVAHS on Staying Healthy in Kimberley on Warringer Radio 693 AM.